So I think the key thing that I take away from this attack, and the one thing that is really surprising to me, Eric, is when we look at past far-reaching attacks like this, and the one that always comes to mind for me is the ransomware attack on Colonial Pipeline, right? Where the Colonial Pipeline was impacted, and it impacted oil delivery on the eastern U.S. seaboard, right? This one feels like an escalation for me because if it hasn't happened yet, this has the potential to kill someone, essentially.
Yes,
You
I'm
know?
absolutely certain there are going to be very bad outcomes because of
Yeah. I so I was talking to a pharmacist about the issue I mentioned earlier, right? My family being impacted by this.
it. Mhm.
Pharmacist, we were just talking about this, and there was mention that okay, yeah, diabetes drugs are not getting to people because if they can't
No,
process the insurance, I, I have no idea what the cost of diabetes medication is. I know it's extremely high. So now you have people not getting their diabetes medication. That's bad. Like
yeah.
I
I was thinking, oh, you're talking about your family member. What if that was my heart med I couldn't get?
exactly. And so like I feel like it is such an escalation because there is a real human cost in this attack.
Yes,
And
yes.
I think my other kind of thought around this attack before I pass it over to you, Eric, is um, I think this has really showcased how brittle the digital systems in our healthcare ecosystem is. And if I was a threat actor, I would be going after every single medical organization I could find right now, trying to find another one like this. And
Mhm.
so I will pass the floor to you, my friend. So I would love to hear your healthcare IT thoughts on this one. This is a doozy.
I think we're a little bit lucky in that I'm sure they're doing exactly what you said, but I'm also sure they have been probing those defenses for a long time.
Right.
And most of your medical industry, if for no other reason because they are legally mandated to, are going to have pretty strong defenses. It'll be interesting if we ever learn how they got in here,
Right.
what that I want to know, and I think most of the world is going to want to know what did they actually do, because I don't think that was either that was a very large feat or somebody got really lucky. Somebody
Right.
left some little doorway open, and that's all it took, obviously.
Right.
So I think your your typical threat actors, and we've said this before, if they had any real ambition, they would be working real jobs and making their money legitimately.
Right.
They're going to go after the low hanging fruit, the most money for the least effort. That is what they're going to do, and that a lot of the things you're looking at when they're targeting, it's because they don't. The companies are kind of operating in the same way. It's like, well, the law doesn't say I have to protect this, so I have other things to do with my investments, and
Right.
it's not going to be that. I mean, one of the reasons we talk about healthcare being expensive in the USA is we spend a lot of money on defense,
Oh yeah.
huge. And your other companies, like if they don't have to, they're not going to want to do that, right?
Right.
So basically, what I'm getting at is, for better or for worse, healthcare is going to last longer than most other. But again, it's a matter of time, and
Right.
it was inevitable. Somebody was going to get broken into. This was going to happen. And the other part, as we were kind of talking about the nature of this attack, like you go to a lot of hospitals and they have like breathing monitors and things that are network connected and sending all this, and those have really big walls around them. But the
And they
hospitals
should. They
here,
should.
oh yeah, they're huge. They're huge. They know. But the hospitals are more or less prepared for a cyber attack, and that, like, okay, if this gets damaged, it's going to be an all hands on deck sort of situation, but we can manage. We'll get around that.
Right.
I need to be careful how far I go with that because obviously the more technology builds up. But for things like, is the patient breathing, right? We can disconnect that equipment, we can pull it out, we can keep it functioning. We have manual ways to work on a lot of the stuff. What you're talking about is a completely different game, and I don't know how many people have put as much thought into it as they had, for instance, a heart monitor, right?
Right.
Because if I prevent you from getting your pills, I don't kill you instantly,
Right.
like I do if I shut off your ventilator or something like that. So, and I don't know. I am not in. I'm at the more on the outside where we have pharmacies in our loop, but I don't. A lot of them work with more specific uh, digital providers that know that industry in and out, and it's very well shielded. There's a lot of effort put in here to keep this data safe.
Right.
So, but that kind of means also I don't have the insights to that I might otherwise. But I can actually see how somebody would be like, well, it's the pills are still being made, they're still on the shelves, they're still being shipped. Are we actually, how risky is this? And well, yeah, it turns out it's a really big risk.
It's a big deal, right? That's
Yeah.
I guess I look at it as just like any industry, there are areas that are more sensitive than others. So in this case, I would equate like the breathing machine to like the bank vault, whereas the pharmacy processing mechanism is like the bank lobby, right? Both important. One obviously requires more security than the other, right? So, uh, it's an interesting and unfortunate situation, I will say. And we could do a whole episode on this as well. I think it sets a very bad precedent for them to have paid the $22 million. I
It, I agree,
and
but they may have just felt like we're there. And you get to a cost benefit analysis of on paper, I'm going to pay this money and this is what's going to happen versus I'm not going to pay this money and this is the level of effort we're going to have to put into for recovery. And if you only look at it from that regard, the math might have been real easy.
right.